Good morning, everyone. This is Dr. Prabhu, a consultant pediatric urologist at Hyderabad. So today we're going to witness or see a pediatric URSL in a 2-year-old child without using an ureteroscope. So let us see how we have done this procedure. Here is a 2-year-old child presented with left-sided abdominal pain and diagnosed to have left upper ureteric calculi, which you can see on this ultrasound, and as well the same is being seen on the CT both in coronal and an axial section. Later on, the child was stented for the same, and the calculi migrated from upper ureter to lower ureter. This is what has happened in 2 weeks of time. Then later on, the child was taken up for URSL. This is the OT setup, and here we have used an 8.5 French cystoscope, and which is about 15 centimeters. And also, this is how the OT schema would look like: the child in the lithotomy position with the bladder being vented upon using a 16 gauge vent flown, and also you see the cystoscope in action. So with the head-up position, this is how we have proceeded for the procedure. Here is a cystoscopic view, and you can see the ureter is already stented with a guide wire. So once you have the guide wire inside, it limits the mobility of the stone and also guides you through the entire ureter. So here is how the cystoscope is in action. And once you identify the calculi, you have used a laser for the lithotripsy here. One has to be very careful while using laser for lithotripsy in a ureter. It should the entire action that you should get the energy on the lower side. Here what we have used is 5 heads and 0.5 joule, which accounts to around 2.5 watt energy is being dissipated onto the stone. You could see the stone is being hit exactly on the center to ensure that there is no energy dissipated out of the stone and hitting the ureter anyway. Now the stone is being retrieved out using a tri-pronged forceps. This is how the stone is being retrieved, and once all the stones are being brought into the bladder, finally this is how the tri-prong is in action to pull out all the stones. And you could also see the bladder has been vented using a 16 gauge vent flown. Here is the 16 gauge vent flown. Coming to the conclusion, so it's a simple procedure, but provided it has got lots of pros and cons. So first of all, I would caution you that unless you have enough expertise, do not use the cystoscope for a ureteroscopy. Now coming to the pros, the availability of the cystoscope is very easy. It's all available everywhere with all the pediatric team, and the vision is absolutely fine because you have an 8 French cystoscope, and it is easy to maneuver as well because of its length, and it has got a larger channel for the entire action of maneuverability of the lasers and as well as the forceps. But the cons are you need a high-end expertise for this, and also it's only feasible in a small portion of children, that too in a small children whose ureteric length is approximately 15 centimeters or so. And location of the stone is always important, particularly if it is in the lower ureter. It would be easy for us to handle this, and it is not it might be a little difficult if you are not pre-stenting this child. So all these children are technically pre-stented to ensure the safety of this procedure. So thank you all for listening. Let us catch up in the next video. Thank you.